Hello everyone, I'm Dr. Maria. I'm a psychiatrist and I'm here to talk to you about brain tumors and psychiatric illnesses. So, mind, manasu, what do we mean by that? Instinctually, we think of our heart as a mind, but in reality, the heart is just a blood pumping organ and the mind resides in our brain. What is the mind? It is a collection of our thoughts, our emotions and our behaviors, and it is a function of our brain. More specifically, there are portions of our brain, namely the limbic system, the frontal lobe, that is the part of the brain right behind our forehead, and the temporal lobe, which is the part of the brain closest to our ears. These are the primary areas that control our mind. So, definitely, we can see that there's a connection between our mind and the brain. There can't be a mind without the brain. Brain per se, if you see, it controls almost all aspects of our living, all our organ systems, from the beating of our heart, to our breathing, to our digestion. Brain tumors, if you see, though rare compared to other cancers, have some challenges owing to the fact that the brain controls all these organ systems. So brain tumors can present with very common symptoms which are easily mistaken or overlooked. For example, a patient comes to us with nausea or vomiting, where we usually think of something wrong with the patient's digestive system. Very late do we even consider something wrong with the brain. So what happens because of this? Because of this, there's a higher chance of patients not being diagnosed at the earliest, and thereby delaying treatment. Treatment too has its own challenges with regards to brain tumors because of the nature of the brain per se. Surgery, radiation, chemo, all needs to be concentrated only on the tumorous growth and not on the normal tissue of the brain. So, as I said, brain tumors come with naturally very common symptoms. Yes, they do come with neurological symptoms like weakness of a part of your body or difficulty in speech, but usually they come with the common symptoms. And even more, the common symptoms can be something like psychiatric symptoms, which are a different challenge altogether. So psychiatric symptoms, if you see, can occur in patients with brain tumors. They can be the primary symptoms, the first symptoms that are noticed in patients. Up to 20% of patients can come with only psychiatric symptoms, whereas anywhere between 50 to 90% of patients will have psychiatric symptoms associated with the brain tumor. So now we know that psychiatric symptoms are very common with patients with brain tumor. And we also understand that it's very important to diagnose these brain tumors early so as to give the patient early treatment and a better prognosis. So what are the symptoms that can happen, psychiatric symptoms that can happen in a patient with brain tumors? So at the outset, I would like to mention that the psychiatric symptoms would depend upon the location, where exactly in the brain the tumor is located, how big it is, how fast it is growing, and what type of tumor it is, and also how many. Is it a primary tumor or is it a metastatic tumor, which can be multiple? So these would affect what symptoms, when they occur, and how they change over the course of time. Now the symptoms per se, these would be anything from the commonplace symptoms like headache or difficulty in sleeping to the more severe ones like an unexplained anxiety, unexplained depression, psychosis wherein the patient starts hearing or seeing non-existent things, believing in things that are not true, mania, or there could be something very subtle like changes in their behavior, in their routines, a decrease in the child's scholastic performance, It could even be a change in the person's routine, hygiene. They would not want to get up to go to work or change their clothes. They could be disinhibited. They could be violent, which was not their behavior in the past. It could also be a change in their eating behaviors, which is a very common symptom, which is frequently overlooked. Eating disorders happening because of changes in the brain. Also, memory deficits, slowing down of their mental thinking speed. All these could be symptoms, psychiatric symptoms associated with the brain tumors. So now the question comes, should we think of a brain tumor each time we see a psychiatric symptom? No. More often than not, a psychiatrist does not order imaging like a CT or MRI brain at the outset. But yes, there are certain circumstances when it is done. What are these? When the psychiatrist feels that the symptoms are atypical. How can they be atypical? In the sense that the symptoms do not follow a particular age or a particular gender. For example, I do not expect a 60-year-old patient to suddenly have psychosis. Why? Because it is usually expected in a young adult. So when a 60-year-old patient comes with first psychosis, I have to think of a brain tumor. Or something else not just brain tumor, anything else in the brain. Again, I do not expect an eating disorder to occur in a middle-aged man. I usually expect it in a teenage female. This again points out to an atypical symptom. Other thing is maybe the symptoms may be inappropriate or out of proportion to the stress, to the given situation or what is expected of you. Yes, there could be some tensions and we might have a headache, but the tension having been over and the headache continues for months or years, that is or getting worse for no apparent reason. This again should warrant us to have a psychiatric evaluation and an imaging done. Other things would be a patient not responding to the usual psychiatric medications or being excessively sensitive to the medication side effects. A special case would be a patient with an already existing psychiatric illness who was well controlled with medications, suddenly has a flare-up while being very regular with medications and follow-ups. Why would this occur? This again gives us a pointer that something is unusual in the brain at that point of time. So psychiatric symptoms can occur at any point of the treatment or at the beginning, during, any time. Like I told you that patients can come with just psychiatric symptoms, come during the treatment of the psychiatrist as side effects to the medications. Any of these things can happen. So how exactly does this happen? So it could be directly the effect of the tumor on the brain, normal brain tissue, which can cause some chemical changes. At the same time, it needn't only be that, it could also be a psychological response to getting a cancer diagnosis. The fear, the guilt of unfulfilled commitments, guilt of being a burden to your caregivers, a sadness for having lost your independence, being completely dependent on your relatives or your caregivers for small things in life. All these, and not to forget the pain. All these can contribute to stress. With regards to treatment, pain again after the surgery or related to the radiation or chemo, side effects to all these treatments, which could include hair loss, weight loss, which can give a very negative body image to the patient. And again, pain, persistent pain, with not getting relief with medications. All these contribute to stress, which can overwhelm our coping systems and cause any of the earlier mentioned psychiatric symptoms. So from this, it is abundantly clear that psychiatric symptoms are very common with brain tumors. It requires the caregiver to be a careful observer, to bring the patient for regular follow-up. There's a need for the general physician, the oncologist, the neurosurgeon, and the psychiatrist, all to have a high index of suspicion and for brain tumors, and also there's a need for a continuous liaison between all these doctors so that we can give the best possible treatment to the patient and rehabilitate the patient to the best possible level. So the role of the psychiatrist in such scenarios